The CDC is warning the public this morning about an increase of a drug-resistant strain of bacteria called Shigella. For more on this and the health warning, we're joined this morning by Dr. Monica Gandhi. Good to see you. It's been a while.
Yeah, thank you.
So by saying that right, Shigella bacteria, what is this thing?
Yeah, so it's essentially Shigella is a gram-negative bacteria, we call it, and it can cause really bad diarrhea, bloody diarrhea. And there's been an increase in cases, 450,000 cases reported in this outbreak, mostly among gay and bisexual men. And the problem is they're drug resistant. So the usual antibiotics that we use that are easy to use, this Shigella has become resistant to it. So it's really going to be about control of behavior, oral kind of fecal spread. That's what's happening to cause this outbreak.
So how does it spread? It's very gross.
Yeah, I'm sorry. So
That's okay. I mean, I asked.
It's oral fecal. I mean, we just got to use that word. So how does that mean? It means that we get exposed to fecal material, like to stool. And it is spreading among gay and bisexual men. Oral sex, rimming. There are practices that can lead to ingestion of some of these bacteria. And it's bloody diarrhea, it's fever, can really hurt to go to the bathroom. And why we're worried is because the really easy to use antibiotics, we have to turn to really harder to use antibiotics that we don't usually use very often. So it is absolutely something to try to contain with just keeping clean, kind of fecal, staying away from fecal matter.
Right. So the prevention steps would be that simple.
Yeah, like washing hands. Do not, I'm just being graphic on TV. So rimming is basically oral sex in the anal area. You want to just keep away from these practices at the moment because you just don't want to be exposed to this bacteria. So anything that exposes you to stool, basically. I mean, that's why it's called oral fecal spread.
Okay.
We're doing this.
Why don't we talk about COVID for a second? I think I got it. I think I understood. Okay, there's a new study, Dr. Gandhi, published in The Lancet. It found that immunity acquired from a COVID infection offers as strong of a protection as the vaccine against severe disease and death. Talk to us about this study and how significant it is.
Yeah, so the important thing about the Lancet study is it's a meta-analysis. So they're put together studies from throughout the pandemic. And this is not a huge surprise, though, that natural immunity works well to protect us against COVID. Actually, the way vaccines work is they simulate natural immunity. They give us a part of the virus, maybe a spike protein from the mRNA vaccines, and then you generate immunity like as if you had seen the virus, but you don't have to see the virus. You're seeing part of it with the vaccine. So we knew natural immunity was going to work, but this is really putting together all the data and saying natural immunity is as strong or stronger than the vaccine. It doesn't mean that MDs and public health officials weren't rightly saying get vaccinated. They didn't want people to be exposed to the virus and likely get sick. So the pushing of the vaccine, honestly, was, part and parcel of public health for a new infection. But if you've already been infected, I think asking someone to get a vaccine mandate, I think this has got to probably not happen anymore because it does work to have been infected in the past.
Are we still seeing the same level of vaccine fatigue that we were, say, a year ago? Are people, are they letting their guard down now that it seems like some time has passed and people are getting COVID and getting over it better? Is that the case?
Yes. I mean, I think the way to think of it is, remember, everyone was lining up and they were jockeying for position to get these vaccines in early 2021, opened up for the whole U.S. for adults in April 2021. People were so excited about it. Getting the 2-dose vaccine was really profoundly helpful to curb the pandemic with COVID. Now, getting boosters, you can see these organizations are kind of all over the place. CDC is saying boosters for all, and many more, I think, nuanced look at that is looking at other countries, what they're doing, and they're giving only older people and vulnerable people and people with comorbidities and on immunosuppressants repeated boosters. I do think that's where we're going to go in the future, even in the U.S. Who's going to need ongoing boosters? People in those risk groups.
All right. Important distinction. Dr. Gandhi, as always, thank you. Health is important. Sometimes it can be messy and a little gross, but it's still good to get the information out there. Thank you. Good to see you. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.